If you've ever been told you have hearing loss, here's an important truth that most people are never told. There isn't just one type of hearing loss, and understanding which type you have can completely change how it's treated, whether hearing aids will help or not, and what results you can realistically expect. Hi, I'm Matt Murphy, a retired audiologist, and in this channel, Sound Solutions by Ear Hero, I'll explain the main types of hearing loss in plain English, no medical jargon, so you can finally understand what's going on with your ears. The first type is called conductive hearing loss. Think of this as a sound delivery problem. Sound isn't getting through the outer or middle ear the way it should. Common causes include earwax blockage, fluid behind the eardrum, ear infections, a hole in the eardrum, problems with the tiny middle ear bones. The key thing to know is this: conductive hearing loss is often temporary and treatable. In many cases, medical treatment or sometimes surgery can restore the hearing close to normal. And when hearing aids are used for conductive loss, they usually work very well because the inner ear itself is healthy and all the patient really needs is louder. The second and most common type is sensorineural hearing loss. This is an inner ear or a nerve problem. Inside your inner ear are thousands of microscopic hair cells. Once they're damaged, they do not grow back. Common causes include aging, noise exposure, genetics, certain medications, head trauma. This type of hearing loss is usually permanent. It typically doesn't get better, and untreated can actually get worse. It's usually gradual and sneaks up on you. Lots of times other people will notice you have some level of hearing difficulty before you even realize it. Worse for speech clarity, not just volume. That's why many people say, I hear people talking, but I can't understand what they're saying. Hearing aids don't cure sensorineural hearing loss, but they amplify and clarify sound to help the brain make sense of speech again. The third type is mixed hearing loss. As the name suggests, this is a combination of conductive and sensorineural hearing loss. For example, someone may have age-related inner ear damage plus fluid, wax, or middle ear problems on top of that. In these cases, treatments usually happen in layers. First, we address the conductive part, if possible, then hearing aids are used to manage the remaining inner ear loss. This is very common and often confusing, if not explained clearly. There are a few other terms you might hear. Sudden hearing loss. This happens quickly, sometimes overnight, and is a medical emergency. Treatment needs to start fast. When someone had sudden hearing loss and came into my office, we would do a hearing evaluation, then refer them to an ear, nose, and throat clinic. In many cases, the ENT would prescribe a steroid, which can reverse the loss, but it needs to be done in the first 48 to 72 hours. Another type is noise-induced hearing loss. This is actually a type of sensorineural loss caused by repeated loud sound exposure. It usually is a high-frequency type of hearing loss and developed over a long period of time. Central hearing loss occurs when the brain has trouble processing sound, even if the ears are working. In these cases, a person hearing can test okay and even have normal hearing, but understanding speech is still difficult. A referral to an audiologist who specializes in auditory processing disorder can run specialized tests for this. Here's why all this matters. If you don't know what type of hearing loss you have, you may buy the wrong hearing aids, have unrealistic expectations, or give up on a solution that actually could help you. One thing I've told patients for years is hearing loss isn't just about volume, it's about clarity, processing, and the brain. Once you understand that your type of hearing loss, everything becomes clearer. Educating yourself not only helps you understand what you need, but also helps you communicate better with your hearing care provider. If this video is helpful, hit the like button and subscribe to Sound Solutions by Ear Hero for practical hearing help with no sales pressure and no confusion. Follow along as I cover more topics, and if you have something you would like to see here, leave me a comment below.